So hello once again, dear students. Now let us continue with our discussion regarding carbohydrates. So this time around, let us discuss the last portion of our topic outline in carbohydrates, which is about your clinical correlation. So basically, we will just be talking about the different diseases involved in carbohydrates, and there are actually three. You have your hypoglycemia, your hyperglycemia, and your inborn error of carbohydrate metabolism. Of course, when we say hypo, meaning decreased, so hypoglycemia means there is a decrease in your glucose level in the body. Hyperglycemia, hyper meaning increased. So for hyperglycemia, there is increased blood glucose level in the body. For inborn error, so we will just discuss that further as we go along our discussion. So let us start with your hypoglycemia. Now, these are the following causes as to why an individual will have hypoglycemia. So first, it could be because there is insulin overdose. Recall the function of your insulin or the action of your insulin. Diba, insulin is our primary hormone that lowers our glucose level. So if there is insulin overdose, of course, sobra-sobra yung pagbaba ng ating glucose level kaya nagkaka-hypoglycemia. Next would be your postprandial hypoglycemia or otherwise known as your reactive hypoglycemia. When we say postprandial, meaning to say after eating siya. Postprandial after eating. And syempre, in a normal individual, hindi naman po agad-agad bumababa yung ating glucose level, especially na kakakain lang natin. Now, with reactive or postprandial hypoglycemia, after or usually within 4 hours after eating, bumababa na kaagad yung ating sugar level. And uh, the reason why the reason why a certain individual could have a postprandial hypoglycemia or reactive hypoglycemia, ang daming underlying causes. It could be because this person undergone surgery or your gastrointestinal surgery. Postprandial hypoglycemia could also mean that you already have a mild diabetes or a pre-diabetes. When we say pre-diabetes, hindi na po normal yung level ng ating sugar, and yet it is not that high or low enough para masabi din natin na may diabetes na talaga siya. So, andun na tayo sa borderline. Next is your fasting hypoglycemia, in which when we say fasting hypoglycemia, meaning to say wala po talaga tayong food intake. That is what we mean by fasting. And the causes of why a certain individual would have fasting hypoglycemia are the following. So it could be because there is insulinoma or your insulin producing pancreatic islet tumor. So because there is a presence of tumor in our pancreas, uh, what happens is that laging nagpo-produce, there is over secretion of your insulin causing to lower your glucose level. Other reasons, it could be due to hepatic dysfunction, or it could also be pwede din po palang magkaka-fasting hypoglycemia due to alcohol consumption. Now, excessive alcohol consumption, drinking heavily without eating anything can actually block your liver from releasing your stored glucose into your bloodstream, causing hypoglycemia. And in relation to hepatic dysfunction, syempre remember that your glycogen is being stored there in the liver. And if there is a problem in your liver, meaning to say, we cannot convert glycogen to glucose, wala tayong stored na mga glucose, and in turn, will cause a decrease in your glucose level. So, yan po for hypoglycemia. Now we proceed with your hyperglycemia. So, of course, I know every one of us is already familiar with the word or with this disease. When we say hyperglycemia, number one that should come into your mind is your diabetes mellitus. When we say diabetes mellitus, it refers to a group of common metabolic disorders that share the phenotype of hyperglycemia. And there are a lot of factors that contribute as to why our glucose level would increase, and it includes the following. So it could be there is a reduced insulin secretion, or it could be that there is a decrease the utilization of your glucose, or lastly, it may be because there is increased production of glucose in the body. So basically, common denominator of this is again, it increases your glucose level. So this graph or image would tell us in terms of relating the different types of diabetes and what would be the common laboratory tests that can be used in order for us to diagnose such types of diabetes. So take note that there are a lot of types of diabetes. You have your type 1, your type 2, your gestational, and there are other specific types pa, in which we will be discussing that one along the way. Again, what we are trying to point out here is in terms of the level of your glucose para po masasabi natin na, na kung normal ba si patient, may pre-diabetes na ba, or may diabetes mellitus na talaga. So again, people with pre-diabetes have higher blood sugar than normal, but not as high as to be diagnosed as diabetic na. So yun yung in-explain ko po kanina na when we say pre-diabetes, andun siya sa borderline. Hindi na normal yung glucose niya, but it's not as high as for us to say na may DM na talaga siya. And it is actually important to also be able to diagnose patients with pre-diabetes because it actually helps us na kumbaga parang sinasabihan na natin si patient na you're getting there. You're almost getting the diabetes, the disease, and thus we could help them change their lifestyle and correct the level of their glucose. Mas madali yung pag-correct pag andun pa sa pre-diabetic stage. And for the common laboratories, that is, common laboratory methods that is being done in order to diagnose diabetes are the following. You have your fasting plasma glucose, you have your 2-hour postprandial glucose, you have your HbA1c. And you also have your, what we call your OGTT or your oral glucose tolerance test. But for the laboratory methods, we leave that one sa laboratory nyo na po na subject. So let us proceed. So, bale, not be overwhelmed. Dili man yun ni nato madiscuss tanan, especially with regards to the other specific types. What I would like to point out here is, again, there are a lot of classification of diabetes mellitus. But what we would be focusing on is your type 1, your type 2, your gestational diabetes. The rest of the other specific types, you have here your genetic defect of your beta cell function, in which, as you can see, it is due to problems in the, may problem dun sa inyong genes. Then, it could be, yung problem mismo is, ang defect is yung action talaga ng inyong insulin. So, andito po yung type A insulin resistance, you have your leprechaunism. So, yung another is also diseases of your exocrine pancreas. Another common din na specific type that could also cause diabetes mellitus is with regards to endocrinopathies. Because if you could still recall yung ating hormone regulation, di ba, ang dami-daming hormones that could actually increase your glucose level. And thus, if there is a problem in the secretion of those hormones, it could indirectly affect it could indirectly affect our glucose level, and thus pwede maging complication na magkaka-diabetes yung ating patient. Diba? From your acromegaly to your Cushing syndrome related to cortisol, acromegaly related to growth hormone, glucagonoma related to your glucagons, pheochromocytoma related to your epinephrines. Diba, those hormones that I have mentioned, na-discuss natin yun siya sa first part sa ating video. And diba, what is their common denominator? Increasing your glucose level. Then, diabetes mellitus could actually also happen due to drug or chemicals na intake Then it could also be because of certain infections, or it could also be immune mediated. Then other genetic syndromes pa that is commonly associated also for diabetes meron. So, ayun, as you can see, ang dami-daming pwede makakos diabetes mellitus. So this one simplified version of the classification of your diabetes mellitus. Ito po, type 1, type 2. So another table lang din po ito for you to read pa. To read and understand better kay baka na-overwhelm po kayo dun sa kabilang table. So we also have this table. Then again, we'll just be focusing on the three. Type 1, type 2, and your gestational. So, this is the classical signs and symptoms of your DM, or usually what we call the triad symptom of your diabetes mellitus. You have your polyuria, your polyphagia, and your polydipsia, your three Ps. Poly, pag andun yung word na poly, it is referring to excessive or increased. When we say polyuria, this is referring to excessive urination, polyphagia, increased appetite, and polydipsia, excessive thirst. Yan po talaga yung tatlong signs and symptoms na mapapansin natin if your patient has, or meron silang diabetes mellitus. Other symptoms would include the following. So, na-mention na natin yung frequent urination, always thirsty, and itong always hungry. So, other symptoms pa is that your patient may always be tired. You may experience na palagi kayong pagod. There could be sexual problems. At the start of your diabetes mellitus kids, at the start, magkaka-sudden weight loss mo, pop up kayo na kumbaga because there is a problem in the utilization of your glucose, ang tendency is that our body is nag-a-activate yung gluconeogenesis nyo, and thus there is a sudden weight loss at the start of your diabetes. Blurry vision, another blurry vision could also happen. When there is a high blood sugar level, it can cause what we call your diabetic uh, what we call, wait, it can actually cause what we call your diabetic problem in the eyes. May specific term yun. Sorry kids nakalimutan ko lang. Basta high blood sugar level could cause yung lens sa ating eyes mismo to swell. That is why the tendency is that nagbo-blur yung ating vision. How about ito, the numbness? For those patients with diabetes, there is numbness or tingling in our hands or feet because high blood sugar level could actually damage the nerves that send signals from our hands and feet. And thus, there is numbness and there is tingling. Increase din ito rin with regards to vaginal infections. Very prone ang women in terms of vaginal infections because if there is an increase in sugar, it can cause yeast to overgrow, particularly sa vaginal area ng women. So that is why prone to developing yeast infection. And then ano pa ba? So yun, wounds that won't heal, and most especially dun sa fit na part. Diba pansin nyo, if may mga kakilala kayo ng mga diabetics, number one talaga na dapat gawin nila is to really take care na dili sila basta-basta na masambat, especially sa tiil. Kay dugay kaayo mahil nga naman, remember, taas na kayo ang blood sugar level, and ang pinaka-last biya na agian sa ato ang blood, na kanang pag-rotate or sa ato ang bloodstream, di ba, sa pag-circulate rather, is ang sa tiil na part. Muna na lisod, mag-heal ang mga wounds, especially on the feet. So, now let us talk about the different classification of your diabetes mellitus, starting with your type 1. So this is how type 1 diabetes mellitus is defined. It is actually the result of interactions of different factors. It could be genetic, environmental, or immunologic that ultimately leads to Take note of this, medyo na-highlight, na the problem with type 1, the underlying cause of type 1 diabetes mellitus is that there is really destruction in your pancreatic beta cells, resulting to insulin deficiency. Again, the problem for type 1 is insulin deficiency. Now, type 1 diabetes mellitus is very common at a young age. Usually it develops most commonly before 20 years of age. So this is the pathophysiology of your type 1 diabetes mellitus na kumbaga we are just looking at why there is destruction in your beta cells. Ito yung ending na makikita nyo. So again, going back to the contributing factors as to why there is destruction of your beta cells, it could either be due to genetic predisposition and due to environmental factors. When we say genetic disposition, there is a problem dun sa inyong genes. That is why, in terms of diabetes mellitus, grabe ang family history yun, ani, na if your parents are diabetics, increase ang chances yun na makakuha mo og diabetes mellitus din. Now, due to these contributing factors, autoantigens will form on your insulin-producing beta cells, and it will circulate now in the bloodstream and in your lymphatics. Siyempre, because these are autoantigens, these are antigens, it is recognized by by our body as something na dapat i-remove. So these autoantigens are now being processed and presented to by your antigen presenting cells to your helper 1, to your T cells, specifically to your T helper 1 lymphocytes and your T helper 2. In turn, the activation of this T helper na mga cells would activate other cells pa or your phagocytic cells. Diba? Your macrophages, your cytotoxic T cells, ano pa ba dire? Activation also of your B lymphocyte to produce your islet cell autoantibodies, and this what we call your anti-GAD65 antibodies. GAD65 meaning ito glutamic acid decarboxylase. So kumbaga, para siyang sunod-sunod na scheme na from the creation of your autoantigens to the presentation of that autoantigens to your T helper cells, activation of phagocytic cells will happen, and since that autoantigen is formed in your beta cells, and since your phagocytic cells are now activated, ang ending yun ana kids is nade-destroy yung beta cells nyo, thus decreasing now your insulin production. So ayun po siya. So there are disease markers that we could actually use in order to diagnose also or to check na may type 1 diabetes sila patient. When we say disease marker kids, meaning we could actually try to assay or check the presence of this one. If meron si patient nito, then increased chances na may diabetes mellitus sila. So the disease markers for your diabetes mellitus type 1 are the following: your islet cell autoantibodies, your insulin autoantibodies, your glutamic acid decarboxylase autoantibodies, and we also have this tyrosine phosphatase 1A2 and 1A2B autoantibodies. When we say autoantibodies, let me just define this one. When we say autoantibodies, these are all antibodies that mistakenly target and react with a person's own tissue or organs. Always remember that the word auto would mean na self. And, di ba, pansin nyo na mention din itong mga autoantibodies a while ago with regards to the pathophysiology na naproproduce sila. And thus, these are specific markers for the diagnosis of your type 1 DM. So now we proceed with your type 2 diabetes mellitus. Now, your type 2 diabetes mellitus is characterized by the following. There is an impaired secretion of your insulin. There is your insulin resistance. There is excessive hepatic glucose production. And there is abnormal fat metabolism. Now, as insulin resistance and compensatory hyperinsulinemia progress, the pancreatic islands in certain individuals are unable to sustain the hyperinsulinemic state. And thus, because there is too much there is too much secretion of your insulin, nagkakaroon ng resistance, yung tinatawag natin na insulin resistance. So to further understand what is this insulin resistance we are referring to, kindly watch this video.
Type 2 diabetes is a metabolic disorder that causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream.
So I guess that's it. So that is what we are referring to insulin resistance, kid. Na kumbaga, may pinoproduce tayong insulin. It's just that it is not being recognized by the receptors present in our cell. And thus, yung glucose natin hindi tinitake up ng cell, nagre-remain sa bloodstream. So, in short, nagkakaroon ng hyperglycemia. I hope na-gets yung concept. So, this is the pathophysiology of our hyperglycemia, in which here in type 2 diabetes, sige lang, mas ma-differentiate ko si type 1 and type 2 later on, may table ako doon. But basically, the other than genetic predisposition, yung isa pang factor ng ating type 2 diabetes mellitus, grabe yung risk factor if we are obese na or if we are overweight. So, because of the presence of these factors, due to genetic predisposition, due to our lifestyle factors, grabe ka sedentary, di tayo active, and then obese pa, increase ang chances of having what we call this insulin resistance. Now, since there is insulin resistance, hindi po siya agad-agad magiging diabetes kids. Of course, our body will try to compensate this problem. And that is why may tinatawag pa po muna tayong compensatory mechanism. When we say compensatory, from the word compensate, when we say compensate, we try to counterbalance. Kumbaga, when we say counterbalance, when we say compensate, meaning to say, kung may problem yung isang organ dito, we are trying to find another solution that could actually still help and reach that balance that we need. So here, due to insulin resistance, what our body will try to compensate this problem, to counterbalance this problem, para mag-reach pa rin yung balance, para mag-normalize pa rin yung ating glucose level, is to cause this what we call your beta cell hyperplasia. So ano po itong hyperplasia? When we say hyperplasia, kids, this is an increase in the number of cells in your organ tissue. So meaning to say, just picture this out. Kunwari si pancreas, si beta cells ninyo normally may 100 lang ka beta cell. Now, with hyperplasia, it will try to increase this number to compensate, to try to balance it out, to compensate the problem na itong insulin resistance. So thus, ang gagawin, instead na 100, dadagdagan pa ng another 100. So ganyan yung meaning ng ating hyperplasia. Again, hyperplasia means that there is an increase in the number of cells in your organ or tissue. And of course, that is reversible. Once na man-normalize na yung level ng ating glucose, babalik pa rin sa normal naman yung ating organ or tissue. So, this compensatory beta cell hyperplasia, syempre, if palagi na lang tayong nag-hyperplasia, palaging ini-increase yung number of beta cells, palaging nagko-compensate, syempre na-overwork na. So, there would come a time na magfe-fail na din yung ating beta cell. And yung early stages ng failure ng ating beta cell, nagkakaroon na ng impaired glucose tolerance. Meaning to say, yung glucose natin hindi na natotolerate. And then, if hindi pa rin ito na-correct, at a later time, thus dun na magkakaroon na ng diabetes. So, ganun yung mechanism ng ganun yung pathophysiology ng ating type 2 diabetes mellitus. So, other risk factors pa, syempre may na-mention na tayo, di ba? But other risk factors for type 2 diabetes mellitus, so na-mention na po natin with regards to family history na again, if your parents have diabetes mellitus, ikaw mismo bantay-bantay na. Kay grabe ka strong ang genetic predisposition or factor gyud sa diabetes. Ito, na-mention na din po natin, sedentary lifestyle. Ano pa po yung other risk factors? Obesity, may high blood pressure, may abnormal blood cholesterol or lipid level. A complication na it could actually be due to increase sa daan ninyong lipid, then magko-complicate, kaya mag-i-increase din yung ating glucose level and magkaka-problem din. Then, gestational diabetes, and then age. Kasi nga, di ba, as we age, nagde-decline din yung ating mga hormones, nagde-decline yung function ng ating organs, kaya increase din yung risk as we age. And then, if you have impaired glucose tolerance or impaired fasting glucose. So, those are the risk factors. So, ito, other risk factors lang din po ito, kids. So, as you can see, may mga specific na mga numbers related to the risk factor. Like, for example, sa hypertension, so kailan natin masasabi na may hypertension na si patient? So, your blood pressure there should be higher than 140/90. So, history of GDM or delivery of baby, na si baby more than 4 kilograms, that is not normal. Pero syempre dili man na siya exclusive na agad-agad moingon ta kay tungod bugat si baby, dako og weight, na dayoy diabetes, dili man pod. But then again, that is still a factor. Family history, obesity, eto, physical inactivity, then we also have race or ethnicity. Bali, I tried to search for that as to why prone labi na ang African Americans. It is said that prone lang din po talaga African American people are more likely to develop diabetes. This is because sa place na din, they are more likely to experience barriers manggod daw, barriers to methods that could lower their likelihood of developing it. Diba? It could be na because of poor environment, so mga ganun. Ano pa ba? Ito, PCOS. Women with PCOS are often insulin resistant. Their bodies can make insulin but can't use it effectively, thus increasing the risk of type 2 diabetes. Medyo factor din po talaga. And 'di ba, related si PCOS sa obesity. Usually, if a woman is obese, prone din po sila sa PCOS. And then those with PCOS, nagiging insulin resistant. Kasi ah, medyo may link in terms of estrogen levels dun sa glucose utilization nyo rin. Acanthosis nigricans, this is with regards to the skin patches that occur sa epidermal skin cells natin, na yung makikita nyo sa mga obese na individual na may darkening sa mga neck part nila, sa mga kung saan yung may mga folds or creases. Actually, that is not related to hygiene. Eh, 'di ba usahay medyo ano na pud gani, medyo late na pud gani na ako na siya na-realize or nabasa pud na that is not actually due to hygiene na tungod kay tambok, 'di ba, namoy makita ng mga itom-itom nila. This actually underlying problem na gyud na gyud nay problem sa ilahang body, and that is what we call the acanthosis nigricans. And that is a typical na kanang what do you call this one? Ma-observe yun ninyo, labi na sa mga obese na patient. And that is also could signify na possible na pwede na kana na certain na individual, increase na po ng chances of getting diabetes mellitus. And then we have history of cardiovascular disease. So how to manage type 2 diabetes? Siyempre, number 1, control your glucose level. How do you control that one? Through diet, changing your lifestyle, and then take note of your diet na dili lang dapat magsigi og carbs, and then syempre exercise to lower down calories, and then certain medications. Another thing is to treat these conditions kasi syempre there is no other way na para mawala ni sila ng mga sakit pa na kasabayan sa inyong diabetes. So, treat associated conditions like your dyslipidemia, your hypertension, obesity, or even your coronary heart disease. And then screen for or manage complications of diabetes, lalo na yung retinopathy. Di ba, common kaayo na siya sa mga diabetic na patients na kanang magka-cataract, problem sa eyes, cardiovascular disease, kidney, nephropathy, neuropathy, and then other complications pa. So, always look at these other complications of your patient na ma-manage pa siya para dili po na kanang maggrabe-grabe or mag-worsen ang sakit sa inyong patient. So, ito po yung sinasabi ko, for you to understand and differentiate better type 1 and type 2 diabetes, look at this table, kids. Number 1 na tan-awon ninyo sa difference ni type 1 and type 2 is the age. Because as mentioned, type 1 diabetes is really common in children and young adults, while for type 2 diabetes, sa mga tiguang na yun ni siya. So those who are already in the adult, kanang mga late adults na, or as our age advances. Another is with regards to, pwede din po yung frequency yung titingnan, kasi very rare yung nagkaka-type 1 diabetes, 5 to 10%, compared to your type 2 diabetes na 90 to 95. Kasi andun talaga yung factor na yung lifestyle. Lifestyle talaga in terms of what we consume. And then, di ba, we also talked about C-peptide level dun sa ating isang video in which this could actually also help. Di ba na-mention ko din to that this could actually differentiate type 1 and type 2. Because in type 1 diabetes, C-peptide levels are very low or sometimes undetectable na. Unlike your type 2 diabetes na normal or we say detectable. Bakit? Balikan po natin yung cause. Diba remember type 1 diabetes, insulin deficiency. There is no production of your insulin kasi destroyed yung pancreatic beta cell nyo. Thus, kasi walang insulin na na-produce, wala din si C-peptide. Diba? Remember, they are co-secreted. Every time insulin is being released, C-peptide also is there. Unlike type 2 diabetes na here, meron insulin. The problem is that it is not being recognized. So thus, your C-peptide level is detectable. Kasi again, walang problema sa insulin na level. Yung problem is ang recognition sa insulin. Ano pa ba? Mhm. So, yun na yung pinaka dapat yung natandaan na difference between type 1 and type 2. Now, ito po. Di tayo ma-overwhelm dito, kids. Diabetic mellitus along the way could develop or could become what we call your diabetic ketoacidosis. Which when we say ketoacidosis, meaning there is a buildup of your ketones in the body, and because of that ketones, nagiging acidic yung ating body. So, bale, the pathophysiology and pathogenesis of how diabetic ketoacidosis develop is due to the following. Start na here. In diabetes, siyempre kasi 'di ba may decrease na insulin na level, thus there is also decrease in the utilization of your glucose, so nagkaka-hyperglycemia. Now, another thing, 'di ba? Remember if hindi na utilize ng maayos si glucose, there will be an increase in lipolysis or what we call your lipid na metabolism. And once kaning mga lipids manggod ninyo atong i-breakdown, isa na ma-release is your free fatty acids, that is your FFA. Now, this increased free fatty acids go to your liver and would also increase this what we call your ketosis. Ano yung ketosis? Ketosis is a process that happens when our body doesn't have enough carbohydrates to burn for energy. And when we say ketosis, this is what we call the creation of what we call your ketones. And these ketones can actually be used as a fuel. Okay? Wala siya kumbaga substitute. Since dili man nato ma-utilize og tarong ang ato ang glucose, so thus mugamit ta og lahi, so naa ni si ketones. Now, since there is overproduction of your ketones, take note that your ketones are actually acidic. They are acidic in nature. Thus, an increase in your ketones will now cause your ketoacidosis. And since there is increased ketones, increase ang chances na ma-detect nato na siya sa urine. By using your reagent strip testing, may ketone na parameter dun, magiging positive na yan siya. And kasabayan ng ketoacidosis nyo kids is this what we call your lactic acidosis. Diba remember your lactate? Lactate is produced when there is a decreased oxygen level. And itong hyperglycemia kasi kids, hyperglycemia may actually increase oxygen consumption. Thus, it can result to hypoxia. And since there is a increase man ang oxygen consumption, meaning na ay decrease na oxygen level sa body, so ang buhato na ana is katong ginatawag nato 'di ba na anaerobic ninyo na process na para na ay mag-compensate or na energy production, and 'di ba ang end ato na product is your lactate. And since mag-increase mo po ninyo ang lactate mo na magka-lactic acidosis. Mo na siya magkaroon og diabetic ketoacidosis. So let me just further discuss pa kaning other parameters. So other than increasing your lipolysis, there will also be increase in the breakdown of your proteins or what we call your proteolysis and a decrease in your synthesis. So kaning proteolysis ninyo katong inyuhang mga amino acids could actually participate. Remember ninyo katong sa catabolism nato na kung di ba could actually participate in your citric acid cycle. And the use up of your protein kids is a part of your gluconeogenesis. Remember the word neo, meaning non-carbohydrate sources in which appeal ang inyong protein. So thus, increasing your glucose level. And then, syempre, no question about increased glycogenolysis. Diba? Again, glycogenolysis, breakdown of your glycogen, transforming it to glucose, thus ang ending, hyperglycemia. So, the common denominator of this, the common denominator of all of this is your hyperglycemia. And since there is increase in your glucose level, in turn, it will also cause hyponatremia or a decrease in your sodium level. Now, ngano magkaroon man og decrease na sodium na level? Since taas na kayo ang inyuhang glucose na level, kids, in turn, it will cause hyperosmolality. When we say hyperosmolality, meaning to say there is increase in the levels of your solute, and your glucose level is a solute. Now, that increase in solute, that hyperosmolality, will cause a movement sa inyong water from your intracellular space going to your extracellular space. And that water shift would cause a dilutional effect sa atuang sodium na level. Kaya nagkakaroon ng hyponatremia or decreased na level sa kay sodium. Muna siya, na-answer na nato ning hyponatremia. Now, proceed ta dire, glucosuria. Siyempre, because there is increase in your glucose na level, it will now reflect in your urine, damaging your kidneys, and that is why glucose is now able to pass through your kidneys and then present na sa inyuhang urine, madedetect na dun sa inyuhang urine. Now, due to glucosuria, kids, due to the presence of glucose in your urine, it will actually cause this polyuria. Polyuria in diabetes occurs when you have excess levels of sugar in the blood, of course. Normally, when your kidneys, normally pag si kidneys nagka-create ng urine, they will reabsorb all of your sugar and direct it back into the bloodstream. But with type 1 diabetes, this excess glucose ends up in the urine, and because there is excess glucose in the urine, it will pull more water and results in more urine. Kaya polyuria, kids, excessive urination. So, where there is increased solute, water will always follow to balance it out. Diba? Ana man na, kay daghan naman good kayo og solute, daghanon po dato si water para mura siya ingana, kids. So, since there is a lot of glucose in the urine, kailangan nato mag-pull po og daghan na water, thus, sige po jud tag ihi-ihi. And that excessive and that pooling of water, kids, that excessive urination, that pooling of water will cause dehydration. Kaya syempre, ginaihi naman nato siya og taman. Sumo na wala na kayo mabilin sa atuang inside sa atuang body, thus dehydration, thus causing excessive thirst. Mo nang magkakaroon og polydipsia. Magsigi og signal, it will always give signal to our body na dapat na magsige na tag inom og tubig. Muna na murag uhaw, perminti ang feeling. And this dehydration or hypovolemia will in turn also cause lactic acidosis. So that is the overall feature or pathogenesis and pathophysiology of your diabetic ketoacidosis. I hope that gets to kids. Wala na gets, do not hesitate to place your question in the or comment your question sa content forum nato sa babaan ni na video. O, diba? Sige. So, what is the criteria for diagnosing diabetes? So, naatay mga criteria para makaingon yun ta kids na akanin si patient na agad siya diabetes. So, just recall the following. If the fasting plasma glucose level is more than 126, again, dili ni siya normal level ha, criteria to diagnose diabetes. Meaning abnormal levels ni. So, if your fasting plasma glucose is more than 126 mg per dl, if your 2-hour postprandial is more than 200 mg per dl or 11.1 millimoles per liter, if your HbA1c is more than 6.5%. So, syempre, di na ako i-explain ni siya kung saan yung FPG, kung saan yung 2-hour postprandial, kung saan yung HbA1c, we'll leave that one sa inyong lab. So, once you are done studying or listening to the video lecture sa laboratory, try to relate it back here. Criteria for defining pre-diabetes. Again, na-define naman nato kaganina unsa ning meaning sa pre-diabetes o kani. If your fasting plasma glucose already reaches 100 mg per dl or for 2-hour postprandial glucose na ani na level or for HbA1c na ani na level. So that's the time na makaingon ta na padulungay na gyud ni si patient magka-diabetes kay naga-increase na ang iyahang sugar level. Next, did you know that we already have this what we call type 3 diabetes, and this is actually your Alzheimer's disease? But I think we are all familiar with Alzheimer's disease. But when we say Alzheimer's disease, the first thing that would come into our mind is ang kanang kalimtanon or na ay memory loss. Alzheimer's disease is a common type of dementia. Murag kumbaga siya ang dementia una, niya worst case is Alzheimer's. So it is a progressive na disease in which it will begins with a mild na memory loss and then kung kadugayan, mo na progressive, di ba? So kadugayan, there will become a loss of ability to carry a simple conversation or respond to anything in the environment. So ingana na siya. So, just to point out lang as to how researchers was able to connect Alzheimer's disease to diabetes. So while the connections are still being investigated, I think until now ongoing mangyapon ni siya na research study, here's what scientists are saying about potential links between diabetes and Alzheimer's. So first, link between blood sugar and Alzheimer's may result from the complex ways type 2 diabetes impacts the brain and body's ability to process sugar and respond to insulin. Second, high blood sugar levels lead to inflammation throughout the body. Research shows people with Alzheimer's have high levels of inflammation. So muna na mura siya nahimong complication na pod. And then lastly, diabetes can also damage the blood vessels, reducing your blood flow. Now, this reduction in blood flow may lead to vascular dementia. Some researchers believe that this vascular dementia may be a contributing factor for your Alzheimer's disease. Ito po yung link or connection na nakita nila as to why the primary cause of Alzheimer's disease is actually related also to your glucose level. Muna, bantay-bantay yun ta sa atong sugar level. Sige, another type, so we are done with type 1, type 2. Another type of hyperglycemia is your gestational diabetes. When we say gestational, kids, always remember the word pregnancy. So it only happens to pregnant women. To any degree of glucose intolerance with onset or first recognition during pregnancy, gestational diabetes is usually seen, especially or nagmamanifest during the second trimester or after 6 or during the 6 month of pregnancy. Now, why nagkakaroon ng gestational diabetes? Pwede magkaroon ng gestational diabetes even if wala sa family history because the problem during pregnancy is that there are a lot of metabolic and hormonal changes that is happening in the body. Possible na katong mga na ay mga oversecretion, ani na mga certain hormones, na ay changes as to how your organs function, nga nakamasalan yun pag magbuntis. So, muna na ah during pregnancy, pwede gyud po jud magka-gestational diabetes. Muna na isa sa gina-test during pregnancy is looking at your glucose level too. Now, take note that insulin cannot cross the placenta, but your glucose can. Thus, if a mother has gestational diabetes and wala niya gi-control, the expected outcome of your baby could be that they are very big. Because again, glucose can actually cross the placenta, pwede siya matransfer sa bata. Ang kanang kadaghan-daghan sa glucose sa inyong body matransfer sa bata, thus pwede si bata po na magkaroon og increase sa sugar level or yun, magkaka-extra weight. So ito po yun siya. A high blood glucose levels in the mother could bring extra glucose to the baby because as mentioned, glucose can cross the placenta. Thus, it causes your baby to put on an extra weight. So, mga big babies yun ni inyong i-expect for those mothers with gestational diabetes. Now, for this image, kids, this is just actually referring to complications between the mother and the baby if may gestational diabetes, in which for mothers during pregnancy, pag may gestational diabetes sila, increase in chances of preeclampsia. When we say preeclampsia, it is characterized by high blood pressure and signs of damage to another organ system, most often your liver and kidneys. While for the babies, if may gestational diabetes, yung baby na nasa loob sa tiyan, prone to congenital defects. And the very obvious or kung pinaka-obvious kayo ana ni na mahibal-an na ay GDM si mama is si baby na ay increased na or na ay macrosomia. When we say macrosomia, this is a term that describes that the baby is born much larger than the average for their gestational age. When we say gestational age, this is the number of weeks sa baby na si baby naa sa imong uterus. And then, if dili makorek si GDM, more complications will follow. So, si mama during labor, na ay induction na of labor, na ay mga cesarean section, mga operative deliveries, while si baby inside, mao po niyahang complications na mahitabo. So, it could be na mahimong premature si baby, na ay mga respiratory distress, na ay mga metabolic complications, na ay mga underlying problems na. And then, what will happen, ganito kasi, gestational diabetes is actually reversible. When we say reversible, by the time na manganak, lalo na if you controlled your sugar level, pwede gyud siya makorek, pwede mawala. But if wala mo gibuhat na anything to control your sugar level, it can actually develop na madiretso na mahimo na gyud na siyang type 2. Ayaw mo pagsalig na kay gestational kung alam man ni during pregnancy lang mawala lang. Then again, if you are not careful enough to control and decrease the risk of foregoing that diabetes, that gestational diabetes, it could really become a type 2 diabetes. And in the same way, it could still affect the babies. Na po na siya long-term na outcome na mahimong obese si baby or pwede po jud niya makuha ang kanang diabetes. Pwede siya magka-type 1 or type 2. Okay? So, diagnostic criteria for gestational diabetes. So, the reference range is slightly, it's different because then again, we are focusing on a different physiological problem here. For fasting plasma glucose, if it is more than 92, possible na naananay gestational diabetes si pregnant women. 1-hour plasma glucose of more than 180 or 2-hour plasma glucose of more than 153. So for this table, we'll leave this one for you to read. This is just to differentiate type 1, type 2, and including na si gestational diabetes. So next, now we go to the last part of our clinical correlations, which is the genetic defects, yung mga inborn errors of your carbohydrate metabolism. Marami po tayong inborn errors, marami po tayong genetic defects, but the common denominator of these inborn errors is that there is a specific enzyme defect sa kanila. Kumbaga may mga specific enzyme deficiency, thus nagkakaroon ng problem. And these genetic defects in carbohydrate metabolism, these inborn errors, are autosomal recessive inheritance. Kumbaga, when we say autosomal recessive, it means na 2 copies of this abnormal gene must be present in order for the disease or trait to develop. Dapat nakuha nyo yung both copies ng gene from your parents para na mag-develop o para makuha nyo talaga yung disease and talagang mag-develop. So, divided into 3, si inborn error, meron po tayong glycogen storage diseases, galactosemia, and your fructose errors or fructose na problems. For this portion, kids, what I would just like to point out here is the enzyme defect, the clinical feature, and the affected na tissue. Basically, ang pinaka-main jud diri is just to look at the enzyme defect. Kasi maumang jud na siya ang ginatan-aw lang diri sa inyong inborn error kay as what I have mentioned, the common denominator lang jud ani nila is nalang yung mga deficiency sa mga specific na enzymes. So here in your glycogen storage diseases, there are a lot of types. Dili lang siya 5. I think this is up to 13, but the most common one are this 5. So for type 1, we have your von Jurki's disease. Type 2, your Pompey's disease. Type 3, your Forbes disease. Type 3 is also actually known as your Cory's disease or Forbes disease. Then you have type 4, your Anderson disease, and type 5, your McArdle disease. Now try to look at the your enzyme defect. Iba-ibang enzyme yung missing sa kanila. For type 1, si glucose-6-phosphatase. For type 2, si lysosomal alpha-glucosidase. For type 3, si amylo-1,6-glucosidase. Type 4 is your 1,4-alpha-glucan branching enzyme. And for type 5, that is your phosphorylase. Medyo different lang din yung clinical features nila. But the common denominator there is usually nagkakaroon ng mga liver and kidney problems, hepatomegaly, mga ganun. So, yun. And then, for the affected tissue, so as you can see, pinaka-common yun is the liver ang affected. Next, for galactosemia. There are also 3 types of galactosemia. When we say galactosemia, there is a problem in your galactose. Galactosemia refers to defect sa mga enzymes that is responsible for the metabolism of your glucose. So, meaning hindi na-metabolize si galactose. Galactosemia, meaning there is increased galactose levels in the blood. So, 3 types. Type 1, the enzyme defect for type 1 is your galactose 1-phosphate uridyl transferase. Type 2 is your galactokinase. Type 3 is your UDP galactose epimerase. The classic galactosemia class is your type 1. Galactokinase deficiency, ang other name ni type 2. Galactose epimerase deficiency is ang other name ni type 3. And for those with galactosemia kids, number 1 na dili pwede gyud ninyo ihatag sa ilaha are those food or beverages that are rich in galactose. Kasi syempre hindi nga nila na-metabolize. Huwag nyo silang bigyan kasi marami na sa kanilang body. Next, for the disorders of your fructose metabolism, you have here your essential fructosuria, hereditary fructose intolerance, and your FBPase deficiency. So as usual, just look at the enzyme defect and then its clinical symptoms. So, di na kahitaan ng regarding sa gene mutation and treatment or even the kaning OMIM number. So, just remember this one kung sa man ito akong gipang point out. Kay kana lamang yun na ang with regards to your genetic defects or inborn errors of your carbohydrate metabolism. Okay. So, that ends our discussion, kids. I hope na nasabtan. I hope na nakuha ang kanang pagka-explain na ako, and if ever there are questions, please do not hesitate to message me, but would really encourage you na i-post yun siya dito sa ato ang content forum. So thank you for listening everyone and have a great day.